Welcome to today's presentation. Today we are talking about Krok 2 2021 booklet. So we're discussing Krok 2 2021 booklet. I know you have been waiting for this. So now here it comes. So this is the first presentation. So let's enjoy it. So we have a 27-year-old man who received an electrical injury when he touched an exposed electrical wire with his hand, after which he developed a circulatory and respiratory arrest. So this is more or less like an electric shock. Now, resuscitation measures restored his cardiac activity after 5 minutes. What complications are possible in few hours or even days after the electrical injury? So definitely this person had an electric shock, which simply refers to the experience of an electric current traveling through the body. Now, living tissue contains water and it is a natural conductor of electricity. That's what you must understand. So in fact, the human body generates about 100 watts of power at rest, and it uses electricity to send signals to internal organs. Example is the heart. Now, an electric shock occurs when an external source of electricity, such as a faulty power line or a lightning strike, comes into contact with a part of the body. Now, this shock can cause severe burns at the point of entry and exit, right? But it can also cause internal damage. So very, very, very important. Very, very important. Now, the severity of the damage depends on the type of current, the type of tissue that it passes through, and how long the contact with the current is sustained. And that's the reason why anytime somebody touches a wire, we have to put a person away from that source of wire as quickly as we can. Other than that, it can lead to a very severe damage to the body. Now, it causes an injury in 4 ways. So electric shock causes injury in 4 ways. 1, we have the cardiac arrest, which is due to electrical effect on the heart. 2, we have the muscle, we have the nerve, and then we have the tissue distractions from the current passing through the body. So, although long-term effects of an electric shock can lead to all of what I've just said, like all that we are having over here, long-term effect can lead to respiratory arrest, acute renal failure, acute liver failure, and so on and so forth. The most dangerous is the circulatory arrest, or basically the circulatory arrest. And that's why the person develops shock. So you see that the blood pressure will be very low and so on and so forth. So over here, we are definitely looking at for what? A respiratory arrest. Circulatory arrest. Circulatory arrest. And that's why your answer is C. A survey X-ray of the patient's abdominal cavity has shown several hemispherical areas of lucency. So there's an X-ray that is showing some area of what? Lucency, located above a well-defined horizontal levels. Well-defined horizontal levels. What might be the cause of such an X-ray presentation? So you have an abdominal X-ray that is showing some areas of what? Lucency, which is hemispherical in nature or in size. And they are saying that it is located above a well-defined horizontal level. What comes to mind? So you must understand that findings on an X-ray that is suggestive of internal obstruction include 1, a dilated bowel loops with air fluid level. So anytime there's an intestinal obstruction or a bowel obstruction, there is a dilated bowel loops with air fluid level. There is a distal collapsed bowel, and there is the absence of gas in the abdomen. There's the absence of gas in the abdomen. Absence of gas. And sometimes they call it string of pills. string of pearls, Pearls, strings of pearl. And all of these things are signaling or they are indicating a trapped fetus. Trapped fetus. Trapped fetus. Now, the word lucency that is used over here simply refers to a less dense regions of structures. Less dense, which means air-filled lungs. Or an example is an air-filled lungs. Normally, to appear darker on the X-ray image, it appears darker on the X-ray images. Now, these symptoms or these X-ray findings can also be seen when people are having a perforated ulcer. A perforated ulcer. In this case, the area of lucency will be below the diaphragm. The area of lucency will be below the diaphragm. And the diaphragm, talking about what? The dome-shaped, the dome-shaped, let me say, diaphragm. The dome-shaped diaphragm, where it separates the lungs or the chest from the abdomen, basically. So anytime you are seeing air under the diaphragm, then you are thinking about the what? A perforated ulcer. A perforated ulcer. So definitely over here, we are looking at what? An intestinal obstruction. An intestinal obstruction. Because there are what? Some areas of what? Lucency that's located above a well-defined horizontal what? Levels. Like I'm saying, then they can add dilated bowel loops with air fluid level. They can add, they can use words like string of pearls. All of these things are signifying that there is what? A trapped air or a trapped fetus, basically. So over here, you are looking at what? A as your answer. So intestinal obstruction, intestinal obstruction. A patient has visited the doctor at a rural outpatient clinic twice during the calendar year. That is in March and then in November. In both cases, he was diagnosed with acute respiratory viral infection. How to fill in the statistical forms for registration of final diagnosis to account for those morbidity cases. So definitely the person that come to you with diagnosis of what? Acute respiratory failure twice in a year. Twice in the year. So this is what? A morbidity. When we say morbidity, morbidity simply refers to what? A disease. Basically, it refers to what? A disease in the population. A disease in the population. As simple as that. As simple as that. So definitely over here, and anytime they use a positive sign means that the person has a disease. Negative sign means the person does not have the disease. So if I say you have a case and it's a negative sign, it means you do not have what? The condition. A case with a positive sign means you have the condition. As simple as A, B, C, D. So this means that since this person visited the hospital twice in the year, anytime the person visited, the person will be marked as a positive sign. So in March, the person had a positive sign for acute respiratory viral infection. And then in November, there will be another sign for acute respiratory infection. What it means that over here, we're going to have what? A B as our answer. So for each case separately with the positive sign. So each case you see separately, and each of them had a positive sign. So that will be what? Our final morbidity case or diagnosis for this patient. So your answer here is B. Your answer here is B. All right. And you can look at the other options. You see the first case with the positive sign, the second case, negative sign. No. First case is positive, second case is positive. And that's why B is the answer. That's why B is the answer. All right. So we have a 55-year-old man who is complaining of general weakness, decreased fluid excretion. So we have decreased fluid excretion and an aching pain in his heart. For the last 15 years, he has been suffering from a chronic pyelonephritis and undergoing an inpatient treatment. I always tell my students, anytime you see a chronic condition, start looking at the possible effect of that condition, because definitely the person is coming with what? The side effect of that condition or a complication of that condition. So over here, if I'm looking at chronic pyelonephritis, definitely I'm looking at a possible kidney damage. Possible kidney damage. So even before I go on and go on and go on, that is what is in my head. All right, but let's continue to read. Now, his skin is dry and has a yellowish tinge. That means there's jaundice. His pulse is 80 per minute. Rhythmic blood pressure is 170. Cardiac auscultation detects a muffled heart sounds and a friction rub in the pericardium. Lab results shows a creatinine level of what, 1.1. Now, this 1.1 is actually very high. So it's actually very high. The normal range is supposed to be between 0.053 to 0.123 millimole. All right. If you bring it to micromole per liter, you are talking about 53 to 123 micromole per liter. All right. And this is equivalent to 0.053 to 0.123 millimole per liter. So if you're having 1.1, it actually means that it is very high, very high. Now, glomerular filtration rate is 5 mils per minute. The average GFR or glomerular filtration rate supposed to be 90 to 120 milliliters per minute. 90 to 120. So this tells me that this person is not having a good kidney, or the kidney is damaged. The kidney is damaged. It cannot filter the harmful substances from the body. So what treatment is indicated for this patient? Definitely, I'm going for what? Hemodialysis. We are going for what? Hemodialysis. We simply is the process of purifying the blood of a person whose kidneys are not working normally. So basically, your answer here is E. So after lifting a heavy object, a 41-year-old man felt a sharp pain in his chest on the right and developed a progressing shortness of breath. Progressing shortness of breath. So again, this is a problem of the lungs, isn't it? Because there's a sharp pain in his chest and he developed shortness of breath. So problem with what? Respiration, problem with the lungs. So the man's condition is severe. His lips and mucosa are cyanotic. Again, cyanosis means what? Bluish discoloration. So his lips and mucosa being cyanotic simply tells you that the person is not perfusing very well. So there is what? Low oxygen saturation, right? Look at the respiratory rate, 28 per minute. Normally it shouldn't be more than 20 per minute, right? But now we're having 28. This means the person is having a labored respiration. Pulse is 112, 122 per minute. Now, over the right half of the chest, percussion shows tympanitis. Again, it means that there's a lot of air in that area, which are trapped. That's you're having the tympanic sound or tympanitic sound. Do you understand? Tympanitic sound. So while oxytocin detects a sharply weakened breathing, the second heart sound is accentuated over the pulmonary artery. His blood pressure is 80/40. Look at it. This person is going hypo. So shock is about to ensue. So what primary emergency measure must be taken at the pre-hospital stage in this case? So definitely, I'm looking at a person who has what? An inflated lung. An inflated lung. And somebody having an inflated lung simply tells you that there is too much of air inside the lungs, which is trapped or which is not undergoing what? Perfusion, adequate perfusion. So it is not being oxygenated very well. I mean, the blood that passes through there are not oxygenated very well, but there's too much of what? Air in that side. And eventually it will lead to a collapse of that lung. And this phenomenon of having too much air in the lung, okay, which eventually will lead to collapse, we call it what? A pneumothorax. 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 All right. So we're having what? A pneumothorax or a right-sided pneumothorax. All right. And normally, if you have a pneumothorax, what you do is what? You pass a chest tube. You pass a chest tube. And this is the most definitive treatment for pneumothorax. And what we mean by passing a chest tube, the aim is to aspirate the air from the pleural cavity. The aim is to aspirate the air from the pleural cavity. So the chest tube does not only drain air, it can also drain blood, it can drain fluid, or anything that is inside what? The lungs. So over here, we're talking about pleural aspiration of air from the pleural cavity. So this was a chest tube, a chest tube. So you pass a chest tube, or pleural cavity aspiration. That's what you do. That's what you do. For a month, a 60-year-old patient had a short-term episode of a decreased strength in his limbs on the left. So again, look at it. There's what a decreased strength in his limbs on the left side. For me, anything that I have, if you have something like this, it means that you are looking at the problem of the brain, isn't it? Because the brain that controls or that gives you strength. So you are thinking of a problem with the brain. So when the left side of the person's body cannot move or it's losing its strength, please start thinking of the brain. Let's continue. Now, later after waking up in the morning, he developed a persistent weakness in his extremities. His blood pressure is 140/90. This is the kind of the border mark for hypertension. All right. And hypertension can be a problem to happen to the brain. Now, we don't know how consistent these blood pressures are. All right. But definitely it can be a risk factor for developing what? A cardiovascular accident or a brain pathology. Now, he's conscious and has central paresis of the seventh and then the 12th pairs of cranial nerves on the left. So again, we are having what? Cranial nerve paresis. Cranial nerve paresis. Cranial nerve paresis. So on the same side, he presents with a central hemiparesis and hemihyperparesthesia. All of these are talking to you about numbness and the fact that he cannot use all these areas that have been affected. Now, what group of drugs must be chosen for the differentiated treatment of this patient? So again, this person is suffering from what? Stroke, which is a problem of the brain, or a cardiovascular what? Accident. A cardiovascular what? Accident. Now, the risk factor here is what? Hypertension, but 140/90 is not enough to cause a cardiovascular what? Accident or to cause a stroke, right? And that is why normally people who are suffering from these kind of condition or CVA, one of the things we give them is aspirin. One of the things that we give them is what? Aspirin. And aspirin is a disaggregating agent. That means it disaggregates platelets. When it aggregates platelets, that means it prevents what? Coagulation. It prevents what? Coagulation. It prevents what? Coagulation. And normally we give to patients who are suffering from CVA because they are at high risk of developing what? Atrial fibrillation. And you don't want that to happen to your patient. When it happens to your patient, trust me, you don't want that to happen. It will cause more cardiovascular accident. Eventually, it will lead to what? Cardiac arrest and so on and so forth. So you don't want that to happen. So you want to give aspirin for this patient. And aspirin is here will be acting as what? Anticoagulant. It will be acting as anticoagulant. That's over here. Your answer will be A. So we have a 45-year-old woman with a normal body weight was diagnosed with diabetes for the first time. Diagnosed with diabetes for the first time. Attempt to correct his blood glucose levels by means of a diet were unsuccessful. Her 24-hour glycemia varies between 10 and 50 millimole. This is quite high. Normally, it shouldn't exceed somewhere between 5.5 or even 6, right? Another person having 10 to 15 millimole per liter. That is high. So which medicine would be optimal in this case? So the question is, what type of diabetes is this? Since it's the first time we're diagnosing a 45-year-old man, I can boldly say this is a type 2 diabetes. This is a type 2 diabetes. So, but in type 2 diabetes, the drug of choice is normally what? Metformin. In type 2 diabetes, the drug of choice is metformin. And metformin is a type of what? Biguanide. And how does metformin works? Metformin works by helping to restore the body's response to insulin. And I don't go through the process of diabetes, how it happens and all that. But I just want you to know the mechanism of how metformin works. So it restores the response, the body's response to insulin. It also decreases the amount of blood sugar that the liver produces, and that's the intestine or the stomach also what absorbs. So it decreases the amount the liver will produce. So that means that it will reduce the glucose concentration inside the blood. It also aids in absorption by the stomach. It also aids in absorption by the stomach. That is what you need to know. However, there is another group of drug. We call them the sulfonylureas. Sulfonylureas. All right. What are these group of drugs? These groups of drugs are used, and it works mainly by stimulating the cells in the pancreas to make more insulin. So they stimulate the cells in the pancreas to make more what? Insulin. They also help insulin to work more effectively in the body. An example is glimepiride. So please take note of some of these medication. Now, it's interesting to also know that sulfonamides are also liable to facilitate hypoglycemia by increasing the insulin release in individuals. Now, research have shown that sulfonamides can potentiate the hypoglycemic effect of sulfonylureas agent when given in combination. So if you give sulfonamides plus sulfonylureas, you tend to potentiate your result. However, like I said earlier on, for me, the drug of choice for type 2 diabetes is always metformin, which is what? The biguanide. However, according to Krok, this is what? Sulfonamides, hypoglycemic drugs. Like I said, it is not entirely wrong because it can do what? Potentiate the hypoglycemic effect of sulfonylureas when they are used in combination. However, I would have gone for what? Biguanide, because metformin, for me, of what I've studied, is the drug of choice for type 2 diabetes. So maybe you can discuss among yourself, group mates, and then see what is really the right answer. But for the sake of exams, sulfonamides, hypoglycemic drugs should be your answer. But in practice, I don't know. But basically, I would have chosen what? Metformin. And I've been choosing it, and it's been helping me anyways. All right. Fluorography of a 45-year-old patient detects a few foci of low intensity with a blurred margins on the apex of his right lung. Okay, so there are what? Some few foci of low intensity. Now, the sign is observed for the first time. Such condition causes him no discomfort. I mean, there's nothing symptomatic about him. He has a many-year history of smoking. So again, there's a risk factor here, smoking. Now, objectively, percussion produces a pulmonary sound above the lungs. The respiration is vesicular. Auscultation detects wheezing. Blood test findings are normal. Make the right diagnosis. Now, the fluorography description of low intensity blurred margins. So this description is typical for what we call focal tuberculosis. Very typical for what we call focal tuberculosis. Now, focal tuberculosis is a limited or a small form of tuberculosis of the lungs. It's a small form of tuberculosis of the lungs. It is characterized by the presence of a few foci, predominantly of a productive nature. When we say productive nature, that means you are able to produce what? Sputum. But this patient didn't come with any sign. So it becomes very difficult in diagnosing this man or this patient. Some of them they can be symptomatic, all right, but others they are what? Asymptomatic. So normally when people come to us for us to diagnose this kind of diagnosis or make a diagnosis like this, normally it's an incidental finding. Basically, it's an incidental what finding when you are doing your X-ray findings or looking for something else. Then whether you can stumble upon focal pulmonary what tuberculosis, but it is not typical. However, there are two main forms. We have the soft focal, and then we have the fibrosis focal, soft focal and fibrosis focal. Now, this is not a time for me to talk more about tuberculosis here and there. I'll give you a full lecture on tuberculosis. I'll give you a full lecture on tuberculosis. However, in case of infiltrative tuberculosis, all right, what you have is that you have an exudative changes. You have what? An exudative changes. That's inclination for distractions. Oxidation, you see an oxidative changes on the X-ray or the fluorography finding. And that is more of what? Infiltrative tuberculosis. Now, tuberculoma is an encapsulated caseous focus more than 1 centimeter in diameter. So that means that in terms of tuberculoma, usually it is encapsulated, or it has like a capsule around it. It has like a capsule around it, and it's more than 1 centimeter in diameter. In peripheral lung cancer, the chest X-ray usually reveals a globular shade connected to the root of the lung, normally in the lower part of the lungs. In disseminated, like the name implies, it is what? It is spreading, or it is disseminated all over the lung bases or the lung zones. All right. So these are some of the things to help you to differentiate them. Like I said, in focal tuberculosis, normally they become asymptomatic. And during your normal X-ray finding, you can just find them there. But normally they are asymptomatic, just like in this patient. So over here, your answer is what? Focal pulmonary tuberculosis. A 54-year-old patient has an over-year history of femoral osteomyelitis. So there's what? Inflammation of the bone in the femur. All right. So now over the last month, he has developed a progressing edemata of the lower extremities. That means that the lower leg is now swollen. Urine test revealed a proteinuria of 6.6. In the blood, there is dysproteinemia in the form of hypoalbuminemia. Again, this tells you that proteins are leaking out. So inside the blood, there's no protein, or the albumin levels are what? Are low. Now look at this. There's an increase in what? Alpha 2 and gamma globulins. These types of proteins, all right, they are light chain proteins. And these light chain proteins are normally found in amyloidosis. These light chain proteins are normally found in amyloidosis. Amyloidosis. So please take note of that. Now look at the ESR. ESR should not be more than 20. Now we're having 50. And normally if you have ESR of 50, it's pointing towards a chronic condition. All right. Now, what is the most likely diagnosis in this patient? Guys, don't forget, this person has already developed what? A femoral osteomyelitis. And as a result, we are having all of this. So again, the side effect or the complication. So again, some of the complications of osteomyelitis could be what? Amyloidosis. But this is not a primary amyloidosis, but rather what? A secondary amyloidosis or secondary renal amyloidosis. Why? Because it is preceded by what? By a condition called ephemeral osteomyelitis. That's over here. Your answer, no, this is not D. This is what? Secondary renal amyloidosis. Secondary renal amyloidosis. That is the answer. All right. A 28-year-old man was hospitalized. Was hospitalized on the 9th day of illness with complaints of fever of 39. There's headache, there's general weakness, there's constipation, there's a disturbed sleep. On the skin of his abdomen, there were isolated roseoles. Guys, isolated roseoles. His pulse is 78 per minute. The liver is enlarged by 2 cm. Make the right diagnosis. Make the right diagnosis. So you have even seen your clues here. So your clue here is the isolated roseoles. Isolated roseoles. Or these are called rose spots. Rose spots. And these are red macules about 2 to 4 millimeters in diameter that occur in the patient with enteric fever. So people with enteric fever, they normally develop this type of what? Spots, or they kind of what? Rashes or macules. Now, on top of enteric fever can either be a typhoid or a paratyphoid fever. Typhoid or paratyphoid fever. And these fevers occur following infection by Salmonella typhi or Salmonella paratyphi. As simple as ABCD. So definitely over here, we are looking at what? At a typhoid fever. So your answer here is what? Is D. Caused by what? Organism called what? Salmonella. And Salmonella are normally found in what? Or can be found in the undercooked eggs. Right? So normally people who eat eggs a lot, they've been found to have typhoid fever. They've been found to have typhoid fever. So these are some of the things you need to know when it comes to typhoid fever. All right. And this brings us to the end of our presentation, and I hope you enjoyed it as much as I did. So I will see you in my next tutorial. So stay blessed.